Case today and the other steps that we're taking. I'm very happy to report there are no new community cases in the community around COVID-19 to report to today. A further 6,121 COVID-19 lab tests were processed in New Zealand yesterday. That takes our all-time figure to 1,518,737 tests that have been processed since the pandemic began. Over the last 7 days, a massive effort by New Zealanders presenting to be tested and by the people working on those tests has seen a total number of just over 38,000 tests across the last week. That's helped to provide invaluable information as we've been working to rule out a possibility of community transmission related to these recent cases. Many people, of course, are looking forward to the long weekend in Auckland, and of course Waitangi Day is not far off as well. Those things have been front of mind for us as we've been working through these recent situations. The level of community testing that we have seen, with no new positive results in the community so far, does provide reassurance at this point that people thinking about whether or not they should be travelling in or around Auckland and Northland over the upcoming long weekends can do so. Our advice today, which Dr. Bloomfiled will expand on, is that there's no reason why people's travel plans should change, given that everybody should already be following the essential Level 1 public health advice. I'll run through the key pieces of advice once again. Please keep washing your hands, follow cough and sneeze etiquette, and of course stay home and do not travel if you are unwell. Contact Healthline and seek a test if you are showing COVID-19 symptoms. Please turn on Bluetooth and scan QR codes as you go. I want to update you on the Pullman Hotel. As I mentioned yesterday, ESR staff were on their way yesterday to do environmental testing to assist the investigation into how the infection was transferred between guests at the hotel. They've been on site all day today, and we're expecting to get the preliminary results from those investigations either later this evening or tomorrow morning. We absolutely need to know exactly what might have been happening at the Pullman and what needs to change as a result of what we learn. That's resulted in specific actions already being taken, including halting movement into the facility. No new guests will be joining them at the Pullman, putting a hold on some guests exiting as necessary to provide additional reassurance, and significant improvements in air conditioning and reticulation. As I said yesterday, more actions are possible as we learn more. The ongoing investigation at the Pullman and further scientific advice is expected at the end of next week, and that will help to influence those decisions. Today I was informed that we may be looking at 2 additional cases at the Pullman, people who are currently at the Pullman where there is evidence that there could have been transmission between those 2 cases, and Dr. Bloomfiled will outline what we know a little bit more about those 2 cases in a moment. We've made a number of changes over the past month to our managed isolation procedures and to our procedures around incoming arrivals. In January, we introduced pre-departure testing for long-haul travellers. Day 0 testing is now in place, and returnees are required now to stay in their rooms until they get a negative COVID-19 test result. And from tomorrow, all returnees will need to stay in their rooms after their Day 12 test prior to their departure. That's an interim step while we continue to investigate what has been happening at the Pullman. I'll now head over to Dr. Bloomfiled for a case update and some further advice around travel over the long weekends.
Thank you, Minister. Kia ora koutou katoa. So first, regarding the Northland case, we first reported on Sunday. This person has recovered and the 11 close contacts have continued to return negative tests, and there are no further exposure events that have been identified at this stage. The close contacts who have coming to the end of their 14-day isolation period will start to be being released from today, and that will continue into next week. Since Sunday, nearly 2% of Northland's population has been tested, just under 4,000 tests, nearly half of those being done on a single day, the first day, January the 25th. The testing and processing of those samples required quick work from many people, and I want to thank the people of Northland who responded and were tested, as well as the staff up there who deployed rapidly and undertook all this testing, and the lab staff in Auckland who processed the tests so quickly. Great team effort, which is what we need, and we've shown we can once again respond to and stamp out COVID-19 if there is a risk of community transmission. To the 2 positive Auckland cases, both are in the Auckland quarantine facility. These 2 people have 10 close contacts, have all been tested, are in isolation, and all those tests have returned negative results. Yesterday we reported 11 close contacts. On further discussion with these cases, 1 has been reclassified as not being a close contact. As of yesterday afternoon, 249 people had received a notification via the NZ COVID Tracer app, having scanned into at least one of the locations of interest, and we've updated the Ministry of Health website with further exposure events and locations of interest. There may be others as we continue the inquiries, and we will publicise those. Those locations include both the place and date and time. And if you were at these places, then the protocol is to isolate and call Healthline about getting a test. So far, 262 people linked to those locations of interest are isolating and have been tested, and I want to thank all of them. So yesterday our Auckland laboratories processed 2,940 community-based tests from the Auckland region, likely to exceed 4,000 once all are logged and processed. And I want to again thank Aucklanders for responding to the call, for being tested, and of course to the staff that have been doing that work. The 2 pop-up centres at Orewa and Albany remain open today, along with the existing community testing centres and testing availability through primary care and urgent clinics. There will still be testing open over the weekend, and the regional public health website will detail where that is available. Now on to the Pullman Hotel. Of the 353 guests who left this facility between the 9th and 24th of January, we have negative results for 314 people. That is confirmed negative results. And then we have the 2 cases as well that are the 2 positives. I should say that that number of 353 does not include the 12 people who travelled on to Australia quite soon after their departure from that facility. Most of the outstanding 39 people indicated they had or were having a test, and our teams are working to reconcile the laboratory results with the information we have on these people. Sometimes there is a mismatch around the NHI number. I have also asked them today to use the local public health unit teams to go and find those people who we are not confident have either had a test or we haven't had any further contact from in the last day or 2, so that we can be confident that all those people are being tested and that we get a negative result. The Minister mentioned the alert level over the weekend. Many will be wondering, of course, what this means for weekend events, and at the moment, as the Minister said, we remain at alert level 1. To date, we have no evidence of community transmission either in Northland or in the Auckland region. Previously, we have had community transmission, but we have not had to restrict movement or shut down or prevent any events going forward. So currently there are no recommended restrictions on events or on travel. However, of course, we can enjoy these sort of freedoms safely if we continue to all do our part. We know the disease is contained in New Zealand, even with these recent cases, but it is uncontrolled abroad. So alert level 1 is not alert level none. All the same basic health measures apply, and you know what these are, but the very most important thing is, please, if you are unwell, do not go out and do not travel this weekend. Please change your travel plans. A special request to people who are travelling around or outside of Auckland or Northland this weekend, or indeed anywhere in the country, please do scan. And if you haven't already, please turn Bluetooth on the app. A special effort this weekend will really help in case we need that information to track people's movements. I do want to thank event organisers in advance for precautions I know they will be putting in place to help keep people safe there. And just on case numbers, there are 6 new border cases of COVID-19 to report. All have been transferred to a quarantine facility in Auckland. 3 additional cases have recovered and 1 previously reported case is now under investigation. So we have 72 active cases and our total number is 1,949. Now, just an update on the 2 cases that the Minister mentioned at the Pullman. I've mentioned over the last few days that routinely we investigate every case in a managed isolation facility and have for some months where if a person tests initially negative but then subsequently positive, we investigate with a specific view to rule out whether there had been any in-facility transmission. For the most part, these cases transpire to be either historical or late onset infection, and we have had a number where we have identified in-flight transmission as being the cause of these so-called late infections. We found out from ESR overnight that 2 cases we had reported earlier this week, one who tested positive on the 24th of January, who arrived in the country on the 13th of January, and a second person who tested positive on the 26th of January, having arrived on the 16th of January, both at the Pullman Hotel. ESR advised us that the whole genome sequence showed a link between those 2 cases. The 2 cases were on the same floor, the 2nd floor in the Pullman, and so what our teams have done, Health and MB, who of course have the lead in running managed isolation facilities, Ministry of Health, as I said, as well as our Auckland Regional Public Health colleagues met this morning to have a good look at what they think may be the cause of that transmission, both of these 2 cases and our earlier 3, and what additional measures may need to be put in place. I just got that information before I came down the road for this media stand-up, and the recommendations from that group that meant are as follows. First of all, reinforcing the measures already in place, that no new arrivals are going into the Pullman, as the Minister mentioned, a significant restriction on movements outside of rooms for everybody, and no movement outside of rooms once people have had that final test at day 12. Additional interim measures that they have advised are that people who are due to depart should depart, but those people, when they go home, will be isolating at home and have a further follow-up test at day 5 as an interim measure, and we will be checking in on them daily to check on their welfare and their health and whether they have any symptoms. There will be increased frequency of testing of the staff in the Pullman, and as an additional precaution, the technical group has advised that anyone who is a member of a household of people who departed the Pullman between the 9th and 15th of January, who has symptoms, should, of course, as they should already be doing, isolating and getting a test, but just a special request there for those people to do that, and we will be sending that information out to those people and their families who did depart at that time. Thank you, Minister.
Just before we get into questions, I do want to remind everybody the global context that we are working within here. Whilst New Zealand has been very successful to date in our COVID-19 response, we do need to recall now, Johns Hopkins today recorded more than 100 million cases of COVID-19 since the pandemic began and 2.1 million deaths. Back home here in New Zealand, we're working hard as members of the team of 5 million, and that hard work has put us in a very strong position, and we're doing everything we can to play our part to keep that. But we must remember that the risk of COVID-19 internationally continues to increase at the moment, and we are likely to see more pressure on our border. That's why we've been taking additional steps like pre-departure testing, like day 0 testing for those arriving in the country. We'll continue to look for how we can strengthen our system and, of course, prepare for the rollout of the vaccine. Jenna.
Sisters who came in from South Africa reported being bundled onto a bus with people from other different high-risk countries. Why is that happening?
Look, we look very closely at the transport arrangements, and it's something that I'm having another look at just to fully understand what's happening there. People shouldn't be put in a position where they are mingling with other flights when they're being transported from the airport to the hotel. That doesn't mean they wouldn't necessarily be on the same transport, but it means they should be separated. There should be distancing between them. So we're looking closely at that at the moment, just to make sure that there hasn't been anything happening there that shouldn't be.
Can you not just put on more buses?
Absolutely, where we need to, we will put on more buses. So I'm looking again very closely to make sure that the rules as we have set them out are actually being followed.
The family believes one of the sisters contracted COVID at the Pullman. They saw people playing basketball, mingling in hallways, failing to social distance. What assurances have you sought and received about those reports?
Look, like I said, I haven't seen those reports. We haven't seen, had them long enough to actually thoroughly make sure they've been properly investigated. But we do follow up complaints like that where people raise those sorts of concerns to get to the bottom of what's happened, to identify whether there's been any behaviour within any of our managed isolation facilities where things have been happening that shouldn't be happening, and we do follow those things up.
Minister, could I just make a follow-up comment on the case of the two sisters? And just to confirm that as part of our routine follow-up and investigation of any cases that arise where someone's returned initially negative tests, these two were looked into. And the conclusion earlier this week from the team on Monday was that these were most likely due to in-flight transmission. And I have asked the team to go back and just have another look at that just to confirm that.
The concerns that they're raising though, if people are playing basketball in MIQ, does that concern you?
I think the Minister's already responded to that.
I mean, can I just say here, people are allowed to exercise by themselves or within their bubbles, right? So if they're in a room with other family members, they go out to get their exercise. If there's a basketball hoop, they're in there shooting hoops while they're exercising, and the only people that they're interacting with in that time are the people who they're in the same room with. I would say that fresh air and exercise is probably quite good for them. But if they're playing with other people from within the facility, then yes, I would be very concerned about that.
Just on the 39 people, I mean, yesterday it was 52. How many of those can you say with some air of certainty that have already had a test out of the 39?
I'll ask Dr. Bloomfiled.
So that's what I've asked the team to confirm. I checked just 5 minutes before coming down. It's still work in progress, but what I can say is that they have got the public health unit teams out from this morning, going out to find these people if they are not getting contact from them or if we haven't seen the lab result come back.
Could you explain the lag there? Because that's a pretty significant piece of this puzzle. There are still 39 people that we don't know the status of. Why is it taking so long to get, I mean, are you having trouble getting into contact with them? What's the issue?
So the good thing is all 353 people contact was made with, and all were asked to isolate and be tested. The vast majority of those we can confirm have had a result, and all but two have returned a negative test. The extra effort is going in on this last group. Again, they have all been contacted, and on recontacted, most of them have said, those who have been recontacted have said, I've had a test or I'm about to have a test.
It's pretty disappointing to you that some of these people haven't really been playing ball with the Ministry of Health.
Well, they may have been playing ball. We just need to confirm that, and I've asked for an assurance from my team by the end of today that we know what is happening with each of those people.
If you don't get the answer you want, why don't you just use your powers and order them to get a test?
My understanding is, and the team did say, that everybody they contacted was quite willing to do what was being asked of them. So I don't think the issue is a lack of willingness. It's just some people have not picked up the follow-up phone calls at this point in time, and so we're doing additional things to track them down.
But it's not a matter of willingness, it's a matter of urgency, isn't it? So they just don't see it as urgent, and the rest of Auckland does.
Indeed, they may well have had the test, and not all of these people are in Auckland, of course. They may be in other parts of the country.
Yeah.
Were you informed of a hotel staffer having a 20-minute encounter with a returnee on January 7, and what's your reaction to that?
Yes, I was informed not long after that. I think it was over that summer period. I think it might have been, the next day I found out about that. I did ask that they do a thorough investigation about, into that, what had happened, and whether there was any further action that needed to be taken. I understand that that person is no longer working for managed isolation.
So it's a sort of a worst case scenario, isn't it? And it's such an encounter.
It's unacceptable behaviour, absolutely.
What did you find out about what happened?
What was that?
What did you find out about what happened?
I understand that the person delivered something to the room, was in the room for a period of time, that there may have been some communication between the guest and that person leading up to that, and obviously I asked for that to be fully investigated and for appropriate action to be taken. I understand that appropriate action has now been taken, and that person's no longer working for managed isolation.
An incident like that won't happen again.
Look, at the end of the day, we ask, we're dealing with human beings, we ask everybody to adhere to the standards that we put in place. I cannot control the actions of every individual, but we absolutely make clear what the rules are, and where people breach the rules, there are consequences.
How were they communicating? How were they communicating?
I understand passing notes. I think one was written on the back of a face mask.
Just to be clear, it was a sexual encounter between the two?
Look, regardless of, I didn't inquire into specifically the nature of the encounter, but there was a 20-minute encounter. That was enough for me to know that that was unacceptable.
Was there physical contact though?
Look, I didn't ask for an explanation of exactly what the interaction had been. That person was in the guest's room for 20 minutes. They shouldn't have been. That was enough for me.
It's like a pretty serious breach of the health order, doesn't it?
Yes, look, like I said, it's unacceptable. There are consequences. The person has already lost their job. There may be others, but at this point...
Pursue any legal action?
Look, again, I'd take advice on that based on what exactly had happened. I haven't yet received that advice, but I know that person's not still working there.
Criminal charges are being considered?
What was that?
Criminal charges are being considered?
Look, I haven't had advice on that at this point.
Are you aware of any other inappropriate encounters?
No, I would have been notified had there been. This is the first one of these that, certainly in the time that I have been the Minister overseeing managed isolation, it's the first one that's come to my attention.
And
Dr. Bloomfiled, are you...
in Australia, in Melbourne, that was blamed for creating the outbreak there, so does that concern you here?
Yes, it is a concern. Like I said, at this point, as far as I know, it is a one-off isolated event. I'm not aware of any other interaction, certainly in the time that I have been the Minister overseeing the facilities.
Bloomfiled, are you aware of the specifics of this encounter?
No, I didn't know about it. Actually, I've just found out about it today.
Why didn't you tell us about it, Minister, when you found out?
Because there was an investigation. You know, when you're dealing with employment matters, you have to follow a natural justice process there. There was an investigation. That investigation's now concluded and the outcome is public.
Conclude?
I'm not sure.
They took to the room?
What was that?
What was it? You said they took an item, I think, to the room.
I believe it was a bottle of wine.
What were the notes they were exchanging? Do you know that?
I'm not familiar. I have not asked to see the details of all of those notes. The fact that the person was in the room for 20 minutes was enough for me to know that that was inappropriate and that they shouldn't have been. I'm not going to ask for a minute-by-minute account of exactly what happened during those 20 minutes.
Doing urgently to...
prior to the person being managed?
I don't know that detail either. Regardless of whether they knew each other, that person should not have been in their room.
What are you doing to urgently address the slipping standards at our MIQ facilities?
Look, I don't think that there are slipping standards. I think that is an isolated one-off event, and I do want to reiterate here that there are thousands of people working across these facilities who work really hard to keep New Zealanders safe, to make sure that COVID-19 doesn't make it into the community. They do so at considerable personal cost to themselves and to their families, in the sense that there is a lot of pressure on them from within the wider community. They are incredibly professional. They are following PPE and infection prevention and control measures, working very hard, and we could not do this without them. So I want to really extend a very warm thank you to everybody who works at our border and in our managed isolation facilities. They are feeling an enormous amount of pressure at the moment. They are very diligent and conscientious. I think one person has let the team down here, and that's unacceptable, and there have been appropriate actions. In terms of the cases that we are dealing with, there does appear to be something happening at the Pullman Hotel, which we haven't yet been able to put our finger on. That's exactly why we've been stopping new arrivals at the Pullman. We will see probably by the end of next week, round about next Sunday, that's when all of the guests who are currently there are scheduled to depart. We will not put more people in there until we've figured out exactly where the weaknesses are and made sure that we've addressed those.
In which facility did this particular incident occur at?
I was told at the time, but I can't recall off the top of my head which one it was. I'm happy to get that information for you.
MIQ spaces are so limited and just for returning Kiwis, Dr. Bloomfiled. How did 12 people in one hotel then manage to slip out of New Zealand?
Oh, look, that's not my area, but clearly there were some people who travelled to New Zealand with the intention of then travelling on to Australia, and they did.
Can I be clear here? New Zealand citizens are entitled to return home to New Zealand. Once they've completed their managed isolation, they are free human beings, free New Zealanders, the same as any others. If they then depart the country and move on, then ultimately that's a decision for them.
It's been reported that a couple of them travelled into New Zealand, onto Australia, onto Korea. That seems kind of weird, doesn't it?
Look, New Zealanders are free to leave the country. We are not stopping New Zealanders from leaving the country. That applies equally to someone who's just arrived as, and finished their managed isolation as it does to someone who's been here right the way along.
Not really appropriate though.
So I'll let you finish that question, then I will come over here.
People using New Zealand as a corridor.
It's possible. I think the number of people doing that would be very limited. I've not seen any evidence that that's a widespread practice, but it's certainly possible.
There are calls for the government to support a people's vaccine and waive rules on intellectual property which allow those with COVID vaccine patents to control the supply of doses. Is this something that New Zealand would consider?
Look, I might get Dr. Bloomfiled to comment on that more generally, but this is an evolving situation. There's a real balance here between working closely with the pharmaceutical companies to get these vaccines developed and out there as quickly as we can. I've warned previously about things like vaccine nationalism, which we're seeing a bit of around the world. That's very unhelpful. Everybody's in this together globally. This is a global challenge and we need to work together. But on the specific issue of patents, that's something that I can either come back with you. I'm not sure whether Dr. Bloomfield wants to make a comment on that.
Thank you, Minister. 2 comments. First of all, it's not the patents that are the constraint here. It's the manufacturing capability and capacity, and that's being stepped up by all these companies at great speed. The second thing is the issue here, of course, that we're concerned about, and I think the people you're talking about are concerned about, is ensuring access to vaccine fairly for people in low-income countries. And global initiatives like the COVAX initiative, which New Zealand is a part of and a contributor to, are designed specifically to help ensure that.
And Dr. Bloomfield, what's the number of people thought to have been infected with COVID in MIQ?
I've asked for that data because, as I say, we've been routinely looking to check that. It's a small number, less than 10 would be what I would estimate, but we will come back with a firm figure of what that number is.
When can we expect that?
I'll aim to have it in the next few days.
Can I note here that we have encountered a few issues before that have been well publicised, including we had some issues with our Russian mariners, the first cohort of those, and there was a thorough investigation as to how there was transmission within that facility at that time. Changes were made in the second cohort of Russian mariners that came through. We didn't see any issues with that. So we are always, whenever something happens, we always look at how it happened, why it happened, and how we stop it from happening again.
Just back to the 12 people who have flown out to Australia from the Pullman, what assistance are you giving the Australian authorities, and do you know how they were able to identify those people so quickly?
I'll ask Dr. Bloomfield. I know he's been involved in those discussions.
Yes, thank you. Actually, the Australians sent a request through our national focal point yesterday, and we replied to them as quickly as we could by asking our customs colleagues which of the people who had been in the Pullman had since departed. In fact, we were so helpful to our Australian colleagues that they knew about it before I did.
On the 12, we've been told that one of those people has since tested positive for COVID-19. Do you have any information about that?
No, I haven't heard that.
Where exactly they've travelled, because we've heard that 12 have travelled to Australia and then some have gone to Hong Kong and Korea. Where exactly have they gone?
I don't have any additional information other than what has been in the media, and it's Australia is the country that would know where people had onward travelled to. I read yesterday that at least three had travelled on, and those were to Hong Kong.
We'll come over here.
Are you surprised that we haven't had any community transmission, any positive test results, given we have had people out in the community with COVID?
I mean, I think the 3 community cases, the cases that have made it out into the community, the evidence is that they've been pretty diligent in the way that they have been behaving, and I really thank them again publicly. I've done that repeatedly. I thank them for that. They've been doing the good things around contact tracing. They have largely kept it to themselves, which is pretty encouraging. I think if we all consider our movements on a week-to-week basis. Certainly the second group, the father and daughter, have been relatively small number of movements, and that's been very helpful.
What's going to be done to police people who are going to be self-isolating once they leave the Pullman?
Mm-hmm. So we will do daily check-ins, phone check-ins, which is what we do, for example, when we have cases in the community and we ask close contacts to self-isolate. We ask them to isolate at home, and there is daily check-in. Remember, these are people who have come out of the Pullman. They have a very high level of awareness of the issues. They are very keen to protect their health, the health of their families and the wider community. So I'm expecting a high degree of support from them.
Is This is sort of a sign that we might look to do this for all MIQ returnees that extra time at home.
So this is an interim measure, and one of the areas we're giving further advice to the Minister on, amongst a whole range of options, is what further things, including additional periods at home and or even testing, might be put in place routinely, and so that'll be one of the areas we're advising on.
Yeah.
Should there be restrictions, or are you looking at restrictions preventing people from flying overseas right after they finish MIQ to prevent something like this happening again?
Look, the reality is once you've finished your managed isolation, we release you into the community on the basis that you don't have COVID-19 and you're not taking COVID-19 into the community with you. Therefore, what you do, you are a free citizen again at that point. Bear in mind that, no one's going through managed isolation as a form of punishment. These people haven't done anything wrong. They are people who are coming back into the country for whatever reasons they're coming back into the country. They're New Zealand citizens or permanent residents. They're entitled to do that. They're entitled to be here.
Dr. Bloomfiled, are you aware of the situation with the cruise ship Lula Prus, which was granted a full economic exemption to enter New Zealand, but now immigration has blocked all but 29 of the crew from coming in?
I can comment on that. My colleague, Minister Chris Farfoy, will be issuing a statement on that and will be available to answer questions on that one.
Can I ask, sounds like officials have hustled and got the Wiggles into the country.
Yes, the Wiggles have been accommodated. There has been a little bit of wiggle room for the Wiggles, and their concerts will be going ahead.
Yeah, but will that mean some Kiwis can't get back into managed isolation? Will they take up their places?
No, I think that they managed to accommodate them just through, sometimes there are cancellations and rooms become available and so on. I think they have managed to find a way to accommodate them.
How many people are we talking exactly here? Is it the Wiggles and their families and like?
Now, I think from memory it's about 18 people, so it's not a huge number, and they're all people who are associated with the concerts.
There's no way that was there any way that these 18 slots could have gone to Kiwis who are desperate to get home right now?
In some cases, no, because they're the result of cancellations. We might not have necessarily been able to reissue the vouchers. So New Zealanders are not being pushed out of the queue in order to accommodate the Wiggles.
Dr. Bloomfield, what was your reaction on hearing about the inappropriate incident in the hotel bedroom?
Well, to be honest, I didn't have time to have a reaction because I found out about it on the way down to the stand-up. So, but I just reiterate the comment of the minister made. The most important comment he made was thousands of incredibly dedicated, incredibly good staff work in these facilities day in, day out diligently to protect all of us, and I don't think we should let the actions of one individual put a cloud over the fantastic work they're doing.
Can I just quickly, I want to reiterate the message of kindness that has characterised our COVID-19 response. Please do show kindness towards our border workers, but also towards those who are being tested and whose lives are being put on public display as a result of our case investigations. It is really important that people can come forward with confidence, that they can share their information where they need to, and that they don't have a huge amount of community pressure heaped on them as a result. The last thing we want is for people to be not willing to work at our border or not willing to come forward to be tested or to share their information because they're concerned about the community response to that. New Zealanders have been incredible in the way we have responded to COVID-19. We've shown compassion and kindness towards one another, and I simply plead that we keep doing that.
Just to clarify, how long are people going to isolate for at home after they've left hotel?
So they will isolate at home. They will have a test on day 5 post-departure, and then they will isolate at home until they've had the result of that test.
And how often will staff now be getting tests?
My recollection is the advice was to move up to twice weekly testing of people working in the Pullman at the moment.
We have a last couple of questions over here.
The MIQ worker that was involved in this incident, do they work at the hotel that's being used as a managed isolation facility, or are they one of the army people who's being brought in to help?
No, my understanding is that they're employed by the hotel.
Just ask for some clarification around the exercising rules, because we've been hearing at some hotels there's a rule that you can only exercise at the same time as people on the same flight as you, but that's not happening at other hotels. So what is the... It
will depend on the physical environment in the hotel, how much space there is. If it's a limited amount of space, then yep, they sort of timetable that space so that people can't interact with one another. If it's a larger space where people can maintain distance from one another, it's possible that there'll be more than bubble of people exercising at the same time. So it really varies because the hotels are quite different. Some of them are inner city hotels where there's not a lot of outdoor space. In other cases, such as some of the ones out by the airport, have very large car parks, for example, where people can get out and exercise.
Are you concerned that 12 people who were at the managed isolation at the Pullman, where there has been transmission of COVID-19, have gone on to travel overseas and possibly could have taken COVID-19 with them?
Look, as I said, that they're free citizens. They've done their time in managed isolation that we've asked of them. The situation at the Pullman is not acceptable. We are concerned about what's been happening at the Pullman, and that's why we're looking at that very closely and why we're not putting anybody else in there until we figured out exactly what's been going wrong there.
Are you concerned that they may have taken it overseas?
Oh, look, I'd be concerned that anyone might have left any of our managed isolation facilities with COVID-19. The last question.
On the saliva testing that you've been offering in some facilities, are you aware of the kind of rough proportion that of workers who are taking up that daily saliva testing? Is it a large proportion?
My understanding is that there's been good interest in it. I can certainly get you the numbers on the number of people who have been doing it.
Yes, we'll come back with the number who have taken up the offer this week, but there was interest, quite a lot of interest.
On that 12 people, therefore, was Australia right to enforce travel restrictions on us because 12 people from the Pullman went over there?
Look, Australia at the moment is making, but we don't have a trans-Tasman bubble. Australia at the moment is making their own decisions. Those are unilateral decisions, as well as their decision to allow New Zealanders to enter without isolation in the first place. So those are really questions for them.
That's a pretty good decision given the circumstances though, doesn't it?
Look, that's a matter for the Aussies.
Thank you. Germany will not approve the AstraZeneca vaccine for over 65s. Will New Zealand follow suit?
Look, AstraZeneca is early on in the process of its approval. My understanding as of a couple of hours ago is that they've not yet applied for approval in New Zealand. So they'll go through the full MedSafe process. MedSafe may take those kind of calls. Thank you very much.